Declare recess at any time. And before I deliver my opening remarks, I wanted to note that today the committee is meeting virtually, and I want to announce a couple of reminders to the members about the conduct of this hearing. First, members should keep their video feed on as long as they are present at the hearing. Members are responsible for their own microphones. Please also keep your microphones muted unless you are speaking. Finally, if members have documents that they wish to submit for the record, please email them to the committee clerk, whose email address was circulated prior to the hearing. Well, good morning again, and welcome and thanks to our members and panelists. I guess I don't have to remind people about the importance of the topic that we are discussing today, the origins of COVID-19. For the past year and a half, the Science Committee and Congress have been appropriately focused on optimizing our response to the pandemic and making sure that the full power of our country's scientific apparatus is engaged in that battle. But now that the vaccines are succeeding at easing in crushing the national caseload of COVID-19, it is time to turn some of our attention to how that international catastrophe started and what can be done to lessen the toll of future outbreaks. We are convening this first hearing to look at the scientific underpinnings of that investigation. There is one profoundly correct reason to pursue this rigorous investigation: to help protect public health and our national security in the future. If we don't learn everything that we can about how infectious diseases like COVID-19 get started, we will be less safe moving forward. Now, as many of you know, I spent most of my career in science before spending the last decade in Congress. And I'd like to thank our witnesses for their very thoughtful written testimony that allowed me to spend a couple of hours last night reading it over and remembering what it was like to think like a scientist. In science, if you see an interesting data set, you look at the logically possible hypotheses that could explain that data. You then look at the statistical likelihood of each hypothesis with a given set of prior assumptions. And then you ask what additional data or measurements are needed to confirm or refute each hypothesis. Then, armed with that new information, including the uncertainties, you enter the engineering phase of the problem, using that information to make our systems work better. And that is one reason why I feel so fortunate to have an engineer, Ranking Member Obernolte, as my partner on this subcommittee. Because in politics, it's often very different. If you see something interesting, the first question is often not what is true, but what can you convince people is true? Sort of like a lawyer convincing a jury. Instead of looking at the full set of facts, we look to cherry pick facts to support your political position. And when this happens, it often leads to bad policy that, in the case of COVID-19, has killed hundreds of thousands of people around the world. And that's why I'm proud of the way that the House Science Committee conducts its business, by letting facts, logic, and science lead the way. Unfortunately, we do not at present have the full set of facts. Right now, American citizens and senior government officials have suspicions about China's role. And there is no disputing that the Chinese government has withheld information and obfuscated efforts to understand the origins. The Chinese scientists were very quick to make sure that the genome sequence of SARS-CoV-2 was available to the public back in January of 2020, which is to their eternal credit. This is the master key that NIH and drug makers needed to start work on a vaccine, and those Chinese scientists are heroes for publishing it. But they took this bold step in spite of the Chinese government and not with its blessing. Let the record show that members of Congress understand that the lack of transparency from the Chinese government about health emergencies of international consequence is a very serious geopolitical and science concern. It is a threat to our nation, and it predates the COVID-19 crisis. And it is not entirely restricted to China. At the same time, China's lack of transparency is distinct from the body of epidemiological data around the origins of COVID-19. The absence of data is not itself evidence of a lab leak or something more sinister. Our witnesses today will help us set expectations and understand what real evidence is and what other ingredients comprise a credible inquiry on disease origins. Patience may be one of those ingredients. We all remember the SARS virus of 2003. Well, it took most of 15 years to identify the original source of that virus. It was ultimately found in a bat cave 1,000 kilometers from the site of the original outbreak. President Biden has asked the U.S. intelligence community to report back in late August on any new information that could bring us closer to a conclusion about the origins of COVID-19. This is a constructive step, but I would caution that there is a very good chance that we still won't have all the answers after that report comes back. Like so many important topics in science, the deliberate endeavor of establishing origins of COVID is likely nowhere near as simple as we'd like it to be. If epidemiology were easy, we'd have the answer by now. If the intelligence community were in possession of a smoking gun about COVID origins, I believe that we would have heard about it. At today's hearing, I intend today to establish some expectations of federal and global leaders in their efforts to investigate the origins of COVID-19 and future diseases. We will not tolerate equivocation and innuendo from public officials. Where the facts aren't clear enough to support a conclusion, please do not offer one just to humor the news media. I ask all members to take care to remember the distinction between the theories of a journalist or blogger and the observations of an experienced science professional with firsthand knowledge of the virus and similar outbreaks. The Science Committee has a long history of playing the long game, of seeing the 10,000-foot view on topics that push the boundaries of human understanding and of transcending political noise. Our witnesses are going to help steer the origins conversation to the high road, where scientific expertise, transparency, objectivity, and data are paramount. We have the four corners of outbreak investigated represented today at today's panel: microbiology, virology, epidemiology, and zoonotics. To the four of you, and too many of your peers have experienced rancor and even threats for speaking out publicly about this politically hot topic, and that is really, really appalling. And your participation today is a service to the public, so thank you again. And I now yield to Ranking Member Obernolte.
Well, thank you very much, Mr. Chairman, and thank you for holding today's hearings on the principles for investigating the origins of COVID-19. Before I begin, I'd actually like to take a moment to commend Chairman Foster for his bipartisanship and his willingness to hold this first official House committee related to the origins of the epidemic. I'm very hopeful that this hearing can serve as an example of how Congress can work together to move forward on investigating the origins of what happened last year. This is not a partisan issue, and I think it's something that we definitely all should work together on. It's also an opportunity for us to begin looking into the principles and standards by which an effective investigation into the origins of COVID-19 should be conducted. And perhaps more importantly, to reflect on some of the lessons that we've learned over the past 18 months about scientific communication, the importance of fair and open public discourse about scientific hypotheses, and the impact that media censorship, the politicization of science, and a possible lack of scientific integrity has had on efforts thus far to investigate the origins of this terrible pandemic. Since the early days of COVID-19, discussion regarding its origins have unfortunately been hampered by the politicization of this entire topic. Renowned, reputable scientists have, at critical times during the pandemic, presented their opinions, unfortunately, as if they were scientific fact. And sometimes avoidable conflict of interests have called into question the independence and impartiality of efforts that have been undertaken to examine the origins of COVID-19, including, unfortunately, some of those at the World Health Organization. These shortcomings have made it much more difficult to have fair and open discourse about this issue. Also, equally troubling to me have been the actions of media, big tech, and their respective fact checkers, which have compounded this difficulty. During the onset of the pandemic, some media outlets latched onto a preordained narrative about the origins of COVID-19, dismissing competing theories as false and even xenophobic conspiracy theories. Social media companies then censored information about COVID's origins, labeling posts as misinformation, despite there being no conclusive evidence for one theory over another. The unfortunate effect of these actions was to shut down legitimate scientific discourse and inquiry, which I think is important to everyone on this committee. Those actions made it more difficult for scientists and the public at large to challenge what had been held out by only a few as scientific consensus, even where the science in fact supported alternative theories and hypotheses. Fear of retaliation, of being labeled as xenophobic conspiracy theorists, and of being ostracized by the scientific community led some scientists to self-censor and remain silent instead of searching publicly and transparently for the truth, which I think is our goal as scientists. To me, censorship in any form is very troubling, but even the more so when it prevents scientific inquiry. So we're seeking to understand the origins of COVID-19, and that matters not so that we can point fingers or assign blame to a specific country or specific leaders, but more importantly, that we can better prevent future outbreaks. That's certainly my intention today as we consider these principles that should inform how we investigate disease outbreaks in the future. And that includes acknowledging the shortcomings that have complicated those inquiries into the origins issue last year. Certainly, we've made a lot of progress. Many scientists, scholars, and journalists are now publicly calling for renewed investigation, and it is my fervent hope that we can move forward with a more open discourse and a productive dialogue. And although I agree with the chairman, we may never definitively know the origin of COVID-19, thanks in no small part to a lack of cooperation by the Chinese government. That certainly does not mean that an investigation into its origins will not bear fruit. And to the contrary, I think the facts and evidence that are uncovered during such an investigation will help us prepare for future pandemics, irrespective of its conclusions. So I'm looking very much forward today to learning more about what that investigation should look for, as well as reflecting on the principles and standards that should form the framework of investigations in the future. Again, I want to thank Chairman Foster for holding the hearing today and thank our witnesses for appearing before us to discuss this very important issue. Thank you, Mr. Chair. I yield back the balance of my time.
Thank you. And we are pleased to have the full committee ranking member, Mr. Lucas, with us today. The chair now recognizes the ranking member for an opening statement.
Thank you, Chairman Foster, for holding today's hearing. And thank you to our witnesses for your participation. While this committee has held a handful of hearings over the last 18 months examining the role of the scientific community in combating COVID-19, I would be remiss if I did not mention that today's hearing is the first official effort in the United States House of Representatives to explore the origins of this pandemic. I hope we can use today's hearing as an important first step towards a full congressional inquiry into the origins of COVID-19. In the last 18 months, the United States has been battling this pandemic, and over 600,000 American lives have been claimed by the virus. COVID-19 is unlike anything we've seen in the United States since the deadly 1918 Spanish flu. But here we are 18 months later, and only just now discussing the principles of investigating the origins of the virus. This conversation is long overdue, and over the past several months, members of House Democratic leadership have made comments that this committee is investigating the origins of COVID-19. This subcommittee hearing is a good start to determining how this outbreak started, but this is not an investigation. In order to get answers on COVID-19 origins, Congress needs to step up and get involved. Relevant committees of jurisdiction, including this committee, need to come together in a bipartisan manner and take this inquiry seriously. Understanding the origins of COVID-19 isn't about scoring political points or detracting from ongoing efforts to fight the virus. It's about preventing and mitigating future pandemics and ensuring that we can responsibly fund public health research. We shouldn't have a preferred outbreak origin theory because we prefer one narrative over another. And we shouldn't bury our heads in the sand and refuse to investigate COVID's origins because we're concerned about what might happen if we get answers we don't like. The job of science isn't to prop up one argument or another. The job of science is to determine the facts. And as policymakers, our job is to take those facts, weigh them alongside other information, and then make decisions. We can't do that without a better understanding of this outbreak. I urge congressional leadership to allow a transparent and thorough investigation of COVID's origins. The Chinese Communist Party has not been forthcoming or trustworthy in sharing information about the origins of the virus. So U.S. federal agencies must work closely with the intelligence community to find answers. I hope we can work together on this committee to continue to support American scientists and researchers at federal agencies, national labs, and academia who've been working tirelessly since COVID-19 reached our shores to continue to learn more about where this virus came from and to eradicate it for good. We also need to work together to improve trust in science. During the COVID-19 pandemic, the way science has been communicated to the general public has not been handled well. Information has been presented in ways that are confusing, misleading, and occasionally polarizing. That's created tremendous problems. The CDC reports that roughly 40% of adults over the age of 18 still remain unvaccinated against COVID-19. The only way COVID-19 will stop spreading in the United States and around the world is if vaccination rates increase and herd immunity is achieved. This message needs to be communicated urgently to the public, and we need to ensure the public has reason to trust that information. For more than a year, people were told there was only one possible explanation for the pandemic, and that any other theories were not only wrong, but dangerous. But now there's an acknowledgement that we don't have conclusive evidence for or against any specific origin theory. That creates mistrust. Communicating science during a global pandemic can be a matter of life or death. We need to do so thoughtfully and accurately. We cannot treat the assumptions and the opinions of scientists and officials as established fact if their claims are not supported by evidence. In order to have a credible investigation moving forward, all available information and theories must be considered fairly, and the process must be transparent, free of conflicts of interest, and protected from political interference. While we may never know the true origins of COVID-19 virus, we owe it to the American people and the rest of the world to give it our best shot at investigating where it came from to better prepare for pandemics to come. I'd like to thank the witnesses again for the participation today, and I look forward to this discussion. Thank you, Mr. Chairman.
And thank you, Mr. Ranking Member. I should say that if you ever got tired of politics, you may have a good career waiting for you as a scientist. If there are any members who wish to submit additional opening statements, your statements will be added to the record at this point. So at this time, I'd like to introduce our witnesses. Our first witness is Dr. David Relman. Dr. Relman is the Thomas C. and Joan M. Merigan Professor in Medicine and a Professor of Microbiology and Immunology at Stanford University and Chief of Infectious Diseases at the Veterans Affairs Palo Alto Healthcare System. He was an early pioneer in the modern study of the human indigenous microbiome. He currently serves on the Standing Committee on Emerging Infectious Diseases and 21st Century Health Threats at the U.S. National Academies. After Dr. Relman is Dr. Stanley Pearlman. Dr. Perlman is a professor of microbiology and immunology at the University of Iowa. His current research efforts are focused on coronavirus pathogenesis, including severe acute respiratory syndrome, or SARS, the Middle East respiratory syndrome, MERS, and COVID-19. His laboratory has developed several novel animal models useful for studying pathogenesis and evaluating vaccines and antiviral therapies. He and his colleagues provided the first rodent model useful for studying MERS, and similar approaches have been used to develop several mouse models for COVID-19. Our third witness is Dr. Connie Price. Dr. Price is the Chief Medical Officer at Denver Health and is a professor of medicine in the Division of Infectious Diseases at the University of Colorado School of Medicine. Dr. Price's research focuses on healthcare epidemiology and methods to prevent and rapidly detect emerging and antimicrobial resistant infections. She has expertise in outbreak management and has served as a consultant to public health authorities around the world on controlling of emerging infections, especially MERS and SARS, as well as Ebola preparedness. Our final witness is Dr. Suzanne Murray. Dr. Murray is board certified zoo veterinarian at the Smithsonian Conservation Biology Institute and serves as both the program director of the Global Health Program and as the SCBI's chief wildlife veterinary medical officer. She leads an interdisciplinary team engaged in worldwide efforts to address health issues in endangered wildlife and combat emerging infections infectious diseases of global significance, including zoonotic diseases. Dr. Murray's work focuses on pathogen detection, advanced diagnostics, capacity building, and collaboration in infectious disease research at the human-wildlife-domestic animal interface. Now, as our witnesses should know, you will each have 5 minutes for your spoken testimony. Your written testimony will be included in its entirety in the record for the hearing. And when you have completed your spoken testimony, we will begin with questions. Each member will have 5 minutes to question the panel. And we will start now with Dr. Relman. You're now recognized for 5 minutes.
Chairman Foster, ranking members Lucas and Obernolte, and members of the committee. I'm grateful for the opportunity to join you at today's hearing. My name is David Relman. I'm a professor of medicine and of microbiology and immunology at Stanford University. Over the past several decades, the rate, distribution, and diversity of recognized emerging infections has accelerated and expanded, especially those involving animal-associated viruses. Among the many reasons, the intrusion by humans into the natural habitats of animals and their viruses, as well as urbanization. In response to these events, scientists have doubled down on efforts to understand these viruses, creating both benefits and risks. Soon after disease first appeared in Wuhan, China, the causative agent was identified, a coronavirus called SARS-CoV-2, whose closest known relatives are found in bats in southern China. The key question became, how, when, and where did SARS-CoV-2 first encounter and infect a human? There are two major hypotheses. First, a natural spillover in which the virus jumped directly from a bat or indirectly from another animal to a human. And second, a laboratory-associated mechanism. Both hypotheses involve human activities, but suggest different opportunities for risk reduction going forward. What is the evidence in support of these hypotheses? First, despite much analysis and discussion, the sequence of SARS-CoV-2 tells us only so much. The problem is that the immediate ancestors of this virus are missing. The most closely related known virus is not that closely related. Meanwhile, SARS-CoV-2 has not been found in nature, and it had not been reported from a laboratory prior to 2020. So, where does this leave us? We have only circumstantial evidence. In support of a natural spillover, first, the fact that nearly all previous outbreaks involving animal viruses are believed to have had a natural origin. Second, the immense diversity of coronaviruses in nature, and the possibility that SARS-CoV-2 is out there, but we simply haven't found it yet. Third, the extensive wildlife trade and the risks that it creates. And fourth, the fact that natural spillovers happen much more often than we had thought. In support of a laboratory-associated origin, first, geography. The closest known virus relatives of SARS-CoV-2 have been found more than 1,000 miles from Wuhan, while the laboratory with one of the largest collections of bat samples and bat-associated coronaviruses in the world is located in Wuhan, where disease first emerged. Second, the risky work at laboratories in Wuhan. Third, the fact that laboratory accidents happen much more often than we had thought. And fourth, the lack of transparency and incomplete information about samples and sequences at laboratories. Again, all of this is just circumstantial. Neither hypothesis can be ruled in nor ruled out. Both are plausible. The goals of an outbreak investigation are to provide greater clarity about the circumstances and factors that contributed to the event. A definitive answer is often not achieved, nor is it necessary for an investigation to yield important benefits. Some of the key elements of a credible investigation concern process, such as objectivity, transparency, representativeness, breadth and expertise, independence, and responsible management of conflicts of interest. Other key elements concern data, such as archived animal samples and derivative data, archived clinical samples and derivative data, and multiple kinds of laboratory information. Importantly, The veracity and provenance of samples and data must be assured. I will close with some observations and suggested next steps. It is unfortunate that the origin issue has become grossly politicized, and opinion valued more than rigorous analysis. Many scientists are hesitant about addressing this issue because of fear that their comments will be misinterpreted. All of this undermines the credibility of scientists and of the scientific enterprise. However, there are signs of progress, including proposals for roles to be played by national academies of science under the oversight and with authorities granted by national and international political leadership. Meanwhile, effective international governance is still a work in progress. I applaud your efforts and urge you to articulate a plan now for an effective investigation of this pandemic and of pandemics that will inevitably follow. Thank you.
Thank you. And next is Dr. Perlman, who will be recognized for 5 minutes.
You're still muted.
Chairman Foster, Ranking Member Obernolt, Ranking Member Lucas, and members of the subcommittee, thank you for the invitation to testify before you today about this incredibly important topic, outbreak investigation for COVID-19 and future infectious diseases. My name is Stanley Pearlman, and I run a lab at the University of Iowa that has focused on coronaviruses for almost 4 decades. I am pleased to join this distinguished panel. There are actually 2 issues to consider in addressing this question. The first is based on the actual origin of the virus, and the second is based on determining how the virus entered human populations. At the beginning of the pandemic, it was postulated by some that the virus was engineered in the laboratory. However, this is not a viable possibility, in my opinion, because one would not know how to design a virus like SARS-CoV-2 from scratch. The next question is whether a naturally derived virus could have been manipulated in a laboratory. Certain characteristics of the virus have been considered as evidence for manipulation in the laboratory. In general, one would need to correctly identify or guess which coronavirus to manipulate, and then correctly determine or guess how to manipulate it. Another question is whether a naturally derived coronavirus 2-like virus could have been passaged in cells in a laboratory so that it adapted to growth in a new type of cell. This virus would have first had to have been present in the laboratory and been growing in cell culture. Most bat SARS-CoV related viruses do not grow well in cell culture, and they exist in the laboratory only as non-viable viral RNA. The general experience is that only some viruses can be grown in new cross-species tissue culture cells and adapt to the new environment. Most of these will lose disease potential when passaged in cell culture, and this also explains how we obtain vaccines like the polio virus vaccine. This leaves a naturally derived virus not manipulated in the laboratory as the most likely source of SARS-CoV-2. Such a virus has not been found in nature, but viruses that are very similar to SARS-CoV-2 have been found in bats. A second question is how the virus actually entered human populations. The possibilities that have been discussed in the public discourse and elsewhere that the virus was transported to Wuhan by an infected human or infected wildlife, or was released from a laboratory that had the virus in hand. The latter possibility has been raised because Wuhan is the home to several well-established virology laboratories. In support of the first possibility, there's increasing evidence that wildlife that is susceptible to infection with SARS-CoV-2, raccoon, dogs, and minks were in fact traded in the Wuhan seafood market. The question of whether release from a laboratory, a lab leak, is harder to address. For example, if the virus was brought into a laboratory by someone working with relevant wildlife, and the virus then infected either that person or someone else in the laboratory, that person could then, in theory, infect others in the community. Therefore, since this possibility cannot be ruled out, it must be appropriately investigated. Both data transparency and international collaboration are necessary and critical for investigations of the origin of an infectious disease. Both the WHO and the US CDC, who have experts who have a long history of epidemiological investigations, and both institutions are natural candidates for working with these studies. It is evident from the COVID-19 pandemic that it's necessary to obtain as many samples as possible at the early stage of the pandemic from a broad group of wild, companion, and farmed animals, as well as from humans with unexplained respiratory or other disease, to have the best chance, or perhaps the only chance, of determining how the virus crossed species to infect humans. COVID-19 has infected so many people around the world that it's impossible virtually to get samples now from present populations. In addition to surveillance, which needs to be done by these both locally and internationally, we need to have risk assessment associated with the surveillance. Otherwise, we're just cataloging viruses. All of these zoonotic SARS and MERS coronavirus spillover events to date have occurred outside of the US. To reduce the risk of a pandemic like COVID-19 occurring again, we need to know as much as possible about viruses circulating in bats and other wildlife populations throughout the world. It should be noted that while much of this sounds seemingly theoretical, we know that there are MERS-like coronaviruses throughout Asia and Africa. MERS-CoV does not spread efficiently between people. However, we learned in 2019 that even though SARS-CoV did not transmit readily between people, a fairly close relative, SARS-CoV-2, does. Similarly, a zoonotic MERS-like coronavirus could evolve and potentially cause a pandemic. Like the SARS-CoV-2, such a virus would pose a grave threat to human populations because, as was the case with SARS-CoV-2, we lack immunity to this virus. And with this, I will conclude my remarks and look forward to answering any questions that you have.
Thank you. And after Dr. Perlman is Dr. Price, who is now recognized for 5 minutes. And whoops, you'll have to unmute, I'm afraid.
Chairman Foster, ranking members Lucas and Obernolte, and members of the Investigations and Oversight Subcommittee. My name is Connie Price. I am a practicing infectious diseases physician and healthcare epidemiologist with experience and expertise in outbreak management. I have served as a consultant to public health authorities on control of emerging infections, including Middle East respiratory syndrome for the Kingdom of Saudi Arabia and severe acute respiratory syndrome for the Ontario Ministry of Health. I am the executive director for HHS Region 8 Ebola and Special Pathogens Treatment Center and HHS Regional Disaster Health Response System. I'm a professor of medicine in the Division of Infectious Diseases at the University of Colorado School of Medicine. I'm honored to be here today to speak with you about the principles for investigating infectious diseases outbreaks. When a threat to the public's health occurs, epidemiologists and other relevant experts investigate the problem so that they can identify sources and risk factors, implement prevention and control measures, and communicate with stakeholders. Whether the event occurs in a hospital setting or in a community, there is a well-described, defined process for performing a complete investigation into the origins of an infectious diseases outbreak. The process requires significant collaboration between public health officials, laboratory personnel, clinicians, and other stakeholders in areas affected by the outbreak. The detailed review begins with the initial cases, but should also include a time period preceding the current problem to determine whether earlier cases existed, and if so, the occurrence rates between the period of the current problem and the comparator period. A high level of data transparency is required, including full and complete access to patient medical records and other pertinent clinical information, to infected patients and their contacts for interviews, and to laboratory specimens and microbiologic isolates for molecular epidemiology, and possibly to other environmental sources or animals should the investigation lead that way. In the United States, there are data collection and preservation standards in place at hospitals to ensure they can track emerging infectious diseases. The Center for Medicare and Medicaid Services requires that a healthcare facility maintains an infection prevention and control program in order to prevent, recognize, and control, to the extent possible, the onset and spread of infection within a facility, including surveillance and investigation to prevent the spread of infection. It also requires that hospital complies with the reportable diseases requirements of the public health, local health authority. To comply with this regulation, accrediting agencies such as the Joint Commission survey hospital infection prevention infrastructure and written plans for detecting and controlling infections. Public health authorities may also monitor required data received from hospitals to look for concerning trends. As part of standard work, once a trend of concern is identified by the hospital infection control program, case ascertainment and maintaining an epidemiologic description of the outbreak will inform initial hypotheses for explaining the potential cause, source, and mode of spread of the outbreak's causative agents. A related step to confirming diagnoses is the need to proactively save clinical specimens for longer than conventional holding periods and not discard them so they are available for further analysis. Both the clinical data and the laboratory data together are essential for tracing an outbreak. These data should inform next steps such as environmental sampling, obtaining specimens from suspect animals such as bats or a suspected intermediary host. When it comes to investigating the emergence and spread of infectious diseases, hospitals and local or state health departments will take the lead, but national and international health authorities are available upon invitation. The CDC, for instance, provides surveillance data and clinical guidance on the management of emerging infectious diseases, but they will also routinely provide consultation and laboratory assistance to healthcare facilities and health departments that are working to solve outbreaks and investigate infection control breaches and other adverse events, but only upon request. Hospitals will reach out through their local and state public health or vice versa if a concerning, reportable, or trend is identified, and that health department in turn may extend a formal invitation to the CDC for help leading an on-site team. Public health will help gather additional information from community cases through interviews, case reviews, observations, and possibly environmental sampling. In the case of a multi-state outbreak, the CDC coordinates that investigation. The World Health Organization will investigate outbreaks if invited by the government, but currently is more often looked to as an important and exclusive source for global surveillance information. Thank you for the opportunity to testify before you today on data and access that investigators need in order to trace an outbreak to a discrete origin. Upholding the principles for transparency, scientific integrity, and objectivity are critical to the understanding. Thank you.
Thank you. And our final witness, Dr. Murray, will now be recognized for 5 minutes.
Thank you so much. Chairman Foster, ranking members Lucas and Obernolte, and members of the subcommittee, as well as distinguished panelists. Thank you for calling the hearing and inviting me to participate. My name is Dr. Suzanne Murray, and I'm the director of Smithsonian's Global Health Program based out of the National Zoo and the Conservation Biology Institute. Recognizing that 75% of these diseases come from the wildlife population first and then jump to the human population, our program was built and utilizes experts in wildlife medicine, human medicine, public health, conservation biology, and epidemiology to study and respond to health issues at the human-animal interface. Recognizing that human, wildlife, and environmental health are all inextricably linked, we utilize this multidisciplinary approach to investigate emerging infectious diseases. We build in-country capacity and train the next generation of health specialists. Determining the origins of a virus is difficult, and ongoing investigation and identification of new viruses can improve and expedite this process. With a robust sample collection, we can more precisely determine how a virus in question is genetically related to variants. This can tell us much about geographic location, host species, and time period over which the virus may have evolved. We learn a great deal of information from data collection from free-ranging species, including but not limited to bats, primates, and rodents. And expanding this data set exponentially is the most critical opportunity we have to better understand the origins of this particular virus. Over the past decade, as part of a larger consortium, we have worked in more than 30 countries and discovered over 1,000 new mammalian viruses. Analysis of these viruses has determined that they represent less than 1% of existing viruses. To more fully understand the origins and evolution of these viruses, continued sampling at an increasing rate is needed. And the best way to accomplish this is by forming and utilize a broad and inclusive approach. The wide variety of factors that contribute to disease emergence underscores the need to develop a multidisciplinary, transparent, and cooperative community that works together to develop and analyze approaches to data collection and protocols for sharing and for this information. Some of this work is already underway now between multiple agencies and organizations, such as NSTC's Health Threat Subcommittee. Additional coordination could further improve our ability to react to the next pandemic. Orchestrating this kind of coordination is not easy. Managing across governments, researchers, and impacted communities is a huge undertaking, especially when no one organization is charged with ensuring that coordination. Even when there is a commitment to work together, differences in how places operate can add difficulty. Principles for transparency and data access range from and vary from community to community based upon several factors, including but not limited to shared trust on how data will be interpreted, utilized, and credited. We've learned a great deal from the current pandemic and other epidemics about what's working well, as well as areas in which we must improve. We've developed invaluable partnerships with many countries, forming a strong and growing One Health workforce to build upon the foundational works in the areas of biosurveillance, viral discovery, laboratory protocol development and implementation, as well as rapid response units and data sharing. Over the past decade, our work has shifted from primary disease surveillance to investigating and better understanding the drivers of disease emergence. In this process, we have increasingly incorporated such essential practices such as modeling, data sharing, and understanding the role of human behaviors, cultural norms, as well as outreach. Further, we are recognizing that science is strongest and most impactful when it draws upon these multidisciplinary assets while being inclusive and contextualized for affected communities, cultures, arts, and broader societies. For instance, some of the most critical and interrelated drivers of disease emergence include land use change, human behaviors, and education that can affect human behaviors. Recently, with internal partners from the National Air and Space Museum, the National Museum of Natural History, Smithsonian's Occupational Health Program, and our Office of Communication and External Affairs, along with outside partners such as UBS's Global Visionaries Program, we are developing a more comprehensive approach to pandemic prevention by incorporating previously underutilized techniques to assess high-risk interfaces more quickly and then truth find this data. This will ensure that our approach is iterative, always learning, and while incorporating infected communities from the beginning and then throughout the process. This will require that we conduct both human and animal surveillance concurrently, utilizing the most advanced data collection methodologies such as smartphone technology and field-based PCR machines. Not only will this more quickly inform scientists and pharma companies, but it will ensure that the public is engaged and informed along the way. Knowledge of pandemic prevention, public health, and vaccinology are helpful to all of us, from communities living at the high-risk interfaces to scientists who study viruses, to economists interpreting the impacts on global economy, to people visiting exhibits such as Natural History's Outbreak Museum, Outbreak exhibit, to the general public reading and watching the news. Knowledge is power, and broadly shared knowledge is absolutely essential to our global health. Thank you again for inviting me to participate in today's hearings, and I look forward to answering any questions you might have.
Thank you. And at this point, we will begin our first round of questions. The chair will now recognize himself for 5 minutes. Before I get started, I have a statement here from the American Society for Microbiology to be entered into the hearing record, and without objection, it will be so ordered. Thank you. Now, Dr. Price, it strikes me that two of the most significant words in your testimony seem to be upon invitation. And it seems like the very extensive set of data that you'd like to have before and during and even after the outbreak of a pandemic are things where you're going to need exceptional local cooperation. One of the lessons that I take away from this and probably from other pandemics is that there's a big incentive for institutions to cover up the extent. This happens, at the family level, at the business level, at the local government, state, nation, even at the level of systems of government. And so how do we, is there an alternative here to doing our best to try to get treaty level commitments in advance that spell out exactly what is necessary here? Because, my fear is that that all the best intended voluntary data sharing agreements will not survive the first contact with the enemy. And what could you say a little bit about what the thinking of the scientific community worldwide is on that?
To establish ground rules before this happens is important. So treaty level, whatever it may be. But at the end of the day, the host country needs to be collaborative, needs to cooperate. So forcing it upon them, we have to do something where it is an agreed upon standard and make sure that we are addressing concerns that they may have about negative impacts and minimizing that for the sake of getting the data and for the sake of understanding the science.
Are there international efforts to get data repositories, for example, that will be immediately accessible ahead of time so you don't have to negotiate that at least? It's one way around part of this.
Well, I think there are some collaborations internationally, but more ad hoc. One well-established venue we have for sharing information is a very low-tech email platform called ProMed. ProMed's been around since 1994 and was established by the International Society for Infectious Diseases. And basically, it is a bunch of frontline doctors, epidemiologists, sometimes veterinarians, just email about things they're seeing that seem odd. Sometimes it turns into nothing, but sometimes it ends up being something. So for instance, the first notification the world had of Middle East respiratory syndrome was through ProMed. On December 31st, 4 days before the World Health Organization announced to the world the SARS-CoV-2, or what later became known as SARS-CoV-2, that had been already released through ProMed. So there are platforms like that that allow early communication and direct scientist to scientist communication. The problem is I think sometimes governments, do get involved in maybe stifling communication through those venues.
Yeah, and Dr. Murray, you held out some optimism that sort of flooding the zone with technology, cheap handheld PCR machines, potentially that automatically report what it is that they've measured in the field, so that when someone is in Barrow, Colorado Island and finds a capybara with a weird viral infection, you can immediately, just to pick a Smithsonian relevant example.
I caught that. Thank you.
Yeah. And so, so that this automatically gets reported to the relevant international database. And that's something where potentially the U.S. Congress could put some money into to get that deployed nationally and internationally?
Yes, thank you very much. I wanted to also just echo what Dr. Price said, because I think that in addition to what you're saying, if with a lot of the partners that we work with, again, in 30 different countries, we have to establish the ground rules ahead of time and also incentivize our partners that if you participate and follow these rules, you get something from it. And if you don't, you don't. So I think that's part of it. And I also think that there are some other projects funded by USAID as well as the Global Virome Project to build platforms upon which a lot of the data of all these viruses, the sequences will sit and be available to everyone. So I think there are some movements afoot. In combination with that, yes, I think that's one of Smithsonian's strengths, using our field sites to, as especially those that are within the hotspots, the areas in which the next disease is most likely to occur, and using the field technologies to identify in the field, and then having the relationships where that can be uploaded and shared very quickly. We have a lot of that existing in Kenya already, some really great relationships with the Kenyan government and Impala Research Center, Kenya Wildlife Services, and National Museums of Kenya, whereby that data sharing can happen very rapidly. So I think another thing we might want to look at is if something is going well, how do we replicate that? And how do we replicate it broadly and quickly?
Thank you. And I am now over my time allotment, so I will recognize Ranking Member Obernolte for 5 minutes.
Thank you, Mr. Chairman, and thank you very much to our witnesses. This has been a fascinating hearing. I have a question for Dr. Relman. In the early days of the pandemic, there was a letter written by a group of scientists that was published in the Lancet and Nature Medicine, two scientific medical journals, in which the theory that anything other than a natural origin theory for the coronavirus should be considered implausible. And I'll read an excerpt of it because I find it a little disturbing. The letter said, "The rapid, open, and transparent sharing of data on this outbreak is now being threatened by rumors and misinformation around its origins. We stand together to strongly condemn conspiracy theories suggesting that COVID-19 does not have a natural origin. Conspiracy theories do nothing but create fear, rumors, and prejudice that jeopardize our global collaboration in the fight against this virus." So after the publication of that letter, and that was just about a month after the appearance of the first case in the United States, so very early in the pandemic. After the appearance of that letter, media and social media companies would refer back to that letter in having their fact checkers label as untrue anyone that tried to express the theory about anything other than a natural origin. So it became this self-reinforcing cycle. So a question for you, at the time that letter was published, would you consider that a statement of scientific fact? Would you consider it a statement of scientific consensus, or would you consider it a statement of opinion?
Well, I think I share with you your concern about statements that don't properly reflect what we know and don't know. Many people have opinions, and I think it's important that people make clear that when they express a point of view, it either is an opinion or based upon something more concrete. And I agree that letter did have a chilling effect on certain elements of public discussion. I understand where many of those letter writers were coming from. They were, I think to a large degree, operating from a perspective of a priori understanding. Past outbreaks have largely occurred through natural spillover mechanisms. And I think it was a reasonable assumption to say this one may well be as well. But every time we as scientists make these statements, I think to your point, we have to be very clear about the basis on which we make them and where there is certainly remaining uncertainty. And then what it is we need to do to either disprove the counter argument or prove our own. And I worry and found it disheartening early last year that there was much too little of that.
So a related question then, how do we prevent this from occurring in the future? Because obviously we are in a period of intense polarization in our society. Science has been politicized in a lot of different areas. How do we prevent this from happening next time? Because obviously I think everyone agrees it was not helpful.
Yeah. It's a complicated question. It's outside my pay grade, but I'll simply point out that there was a larger sort of cultural problem, societal problem with the tenor of discussion at that time. And as you well recall, there were others outside the scientific community who were making very forceful and almost defiant statements that made it difficult for any of us with more measured arguments to insert our positions into this public discourse. So I think the answers come from multiple directions. We need to remember what the scientific process is about, who and how it's undertaken, and simply better inform our public as well about how to judge statements that are being made and the questions they should be asking of all of us.
Right. Well, thank you. And then final question for you. You didn't touch on it a lot in your testimony today, but in your written testimony, I was interested in when you were talking about the Wuhan Institute of Virology and the possibility of a lab leak from that institution. You discussed some of the practices for studying viruses there that you consider risky. Can you talk a little bit more about that?
Sure. Well, I want to start by saying that I think the rest of us, the rest of the panelists here, and I share a lot of similar sort of thinking about this. If there is an origin or an argument to be made about the possibility of a laboratory origin here, I think we have to consider first the possibility that there was unrecognized presence of this virus either in the laboratory through samples that were collected or an encounter by a laboratorian out in the field. and that the infection perhaps was asymptomatic or simply not recognized. But I am concerned about the unregulated lack of proper discussion about how we go about examining diversity in nature. And I fully support the statements that have been made by Drs. Murray and Price and Perlman. But when we collect lots of sequences, we have to ask, what's their relevance? And the way in which some of this relevance is determined is by scientific experimental means, either by trying to grow the entity that we think resides within the sample, or by trying to recreate it or study a piece of it. And what I think concerns me is that we haven't yet had a proper discussion about where there may be risk in some of these experiments, not the majority, but some of it, that hasn't been properly addressed and that we need to sort of confront and discuss more openly. And I'll just call out a certain set of experiments that have been published by the Wuhan Institute that I view as particularly risky. In this work, they started with a natural isolate, a bat coronavirus called WIV1, which a good friend and colleague of mine, Ralph Barrick, had already studied and declared to be a virus poised for human emergence. This is WIV1, came out of a bat in Wuhan Institute of Virology. And their approach for studying novel sequences that they found in other samples was to take a piece of those genomes, a piece of that sequence, and swap it into this WIV1 virus. They then resurrected a few of those viruses and grew them in the laboratory. So now we're talking about a chimeric virus with properties that we don't know yet. We can't predict well. That was the purpose of the experiment. Those are experiments that concern me. And I'm not saying that they led to this outbreak or pandemic by any means, but it's simply the kind of work that I think we as a scientific society need to think much more clearly and more deliberately about before we undertake it. Again, in the search of answers to important questions about the diversity in nature.
Thank you. Well, thank you, Dr. Relman. I see my time expired. Thank you to all of our panelists for this fascinating discussion. I yield back.
Yeah, and I gave you a little extra time because of the extraordinary interest in that question. It's one of the threads that this subcommittee is going to have to be looking at, just trying to understand what the definition and limits of dangerous research are, and how we deal with that internationally. We'll now recognize Representative Perlmutter for 5 minutes.
Thank you, Mr. Chair, and to the panelists. Thank you very much for your testimony today. I feel compelled to defend something one of my best friends in life, the chairman, had to say early in his introduction, and that is concerning the scientific method and the ability of, whether it's a lawyer or a politician, our responsibility is to make decisions based on the best information we have available to us at the time. And it may not be perfect in the scientific method. And Dr. Relman, you go through the 6 factors that you consider as part of the scientific method. But, it takes time, obviously, to understand the origin of things, to understand this virus, and decisions had to be made. And just for the record, I'll read something President Trump said at the time in late January of 2020. China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well. In particular, on behalf of the American people, I want to thank President Xi. And he goes on for the next 2 months, thanking China for their tremendous efforts with respect to the coronavirus. And when I look, Dr. Relman, at the points that you make as to the scientific method, you say verifiable and reproducible, transparent, representative, expert, independent, and without conflicts of interest. And so there are a number of things within that list of components as to how to prove a point where you introduce people. And when you introduce people, then you start losing some of the facts that my chairman and my physicist friend, Dr. Foster, finds so concrete. And so just to defend lawyers and people who have to make decisions, I want to say it's not all that cut and dried. Now I want to turn my attention to a Coloradan and a buff, and I want to thank her for being part of our panel today. I want to ask Dr. Price. In Colorado, we've now seen the Delta variant overtake all the other types of viruses and variations of viruses, and it makes up 3/4 of the cases that we now see in our state. From your point of view, Dr. Price, what steps can the international public health authorities take to prevent new strains like the Delta variant from emerging?
Well, I think we're starting that now with vaccination. And I think the trick is to get vaccinated before these new strains emerge and allow to take hold and circulate enough where they can start infecting others and potentially even vaccinated people. So that's a first step. And then the second step, and my virology colleagues are already doing, is keeping track of the evolution of this virus. And when we need to tweak the vaccine or create a booster that will cover different variants, that we are on top of it and we're constantly surveilling very proactively to be able to design a booster or a new vaccine to overcome it.
So in your testimony, you talked about sort of there has to be a little level of trust among the scientific community, among epidemiologists, among the vaccinologists or virologists. So how does one build that trust so that you can work with Dr. Perlman or Dr. Murray and know that you're getting straight information?
Yeah, well, you have to respect that when a host country or when another lab invites you in to investigate and help them solve a problem, that it is their data that you are working with. And the way to get access to it is to be invited and agree on the objectives. And you need to have that collaboration. I mean, both philosophically and practically. So philosophically, it's important for the host country, in my experience, to be viewed as the lead for solving the problem, that they want to solve a problem that they might be viewed as creating. So you are there in the capacity of a consultant, not to parachute in and take data and then publish on behalf of yourself and the United States. So you have to remember just basic, human consideration. And then practically, it's very important because you're going in reviewing charts in another country. They may be in a different language. They may have different medical norms. They may, you need their people there alongside you to work together and do this collaboratively. So stay focused on the scientific question you seek to answer. Do not make conclusions with incomplete data. Resist the urge to start making conclusions and communicate often with their government authorities. And make sure you're not exploiting the host, whether it's an underdeveloped country that often this happens in, or in a developed country, that you're not going in to try to get something on behalf of, your own country or your own institution or academic career.
My time has expired. I thank you, and I'll yield back to the chair. And I just felt compelled to defend lawyers and politicians. Thank you.
Thank you. And we'll now recognize the ranking member, who is, I believe, neither a lawyer nor a scientist, and yet a tremendous contributor to this committee.
Thank you, Mr. Chairman. Being a farmer by trade, and my university training is in agricultural economics. So how to allocate those finite resources among the unlimited demands to achieve the greatest possible rate of return. And if I wanted to put you to sleep, we would discuss the inelasticity of the demand for food, but that's a whole different subject. Turning to Dr. Relman, since the early days of the COVID-19 pandemic, China has not been transparent with the rest of the world about how the virus began to spread in Wuhan, China, or shared reliable data that could inform on the possible origins. So thinking about the last exchange between my colleague and one of your wonderful fellow witnesses, recognizing this, how do we move forward in investigating the origins of COVID-19 without cooperation from China? And how must Congress, federal agencies, and scientific community more broadly work together to do this? I'll give you the big question, Doc.
Thank you for that, Congressman. Well, I have to turn back to my co-panelist, Dr. Price, and suggest that we are in dramatic agreement on a number of the points that she made. But I will make a distinction between the importance of relationships amongst scientists and the kinds of relationships that exist between governments. And here I will again reflect much of the sentiment by Dr. Price. There have been, in fact, very good working relationships between scientists in the United States and those in China at these very institutes. I've been on trips to those places and have met many of those scientists and greatly respect them. And I think, in fact, they have much to share if we could create the right circumstances under which they feel allowed and empowered to do so. It's a very complicated task, and I don't mean to suggest that any of this is easy, Congressman Perlmutter. It is not, but it doesn't mean that we shouldn't try. And I'll point out that our National Academy of Sciences and the Chinese Academy of Sciences held a series of meetings last summer, of which I participated, where we had some very fruitful discussions. They did not involve the governments of our two countries, and I think there was some useful progress made. So I'm maybe an idealist and optimist, but I think that if we can build these kinds of relationships amongst scientists, we can start there and then find ways in which to take into account the interests of our governments and other larger institutions.
Continue with you, Doctor. In your written testimony, you disagree with the argument that further clarity about the origins of COVID-19 is not needed. So could you explain to us, and remember, we are a conduit to the great American people, the folks who ultimately pay and suffer or benefit from our actions. Could you explain to us and them why it is so important that we investigate the origins of COVID-19 and what an investigation into the current pandemic how it would enable future pandemic preparedness and response?
Be happy to. I would say there are at least four benefits to an effort to understand the origins. The first is a point that's been made already, that anything we learn will help us devote resources and design strategies to both anticipate and prevent the next pandemic. That's first and foremost. Second, we will learn how better to investigate outbreaks. That's a point that's already been made by my fellow panelists. Third, we may deflect further recriminations and perhaps some finger pointing by the gaining of greater clarity. And then fourth, if there is further evidence that perhaps accidents occurred in the conduct of science, then I think we will be forced to have conversations and further discussions beyond that which we have already had in this country that look more carefully about where there is risk that perhaps deserves special attention.
In your written testimony, again, you discussed the two predominant COVID-19 origin theories. What I would now ask you is, moving forward, how do we better communicate scientific and factual evidence so we can continue to investigate the origins of COVID-19? How do we regain that trust? How do we convince the American public of the merits of what we need to do?
Yeah. I know we're almost out of time, but let me just suggest that the first place would be something that Dr. Price has already mentioned, the great importance of transparency in all of the information upon which we base our statements. And that has to come from all quarters of the globe, not just China, not just the United States, but every other place where there's useful information about the virus, the early clinical events, and everything else that we have to understand about this ecosystem. So data transparency is where we start, and that should be made available to the world's public as well.
Thank you, Doctor. And with that, Mr. Chairman, I would yield back, noting that the general public doesn't necessarily always understand what goes on behind those lab doors where you worked all those years, and we need to make sure they understand it is to their benefit and the future of everyone that those things happen. Yield back.
I agree. And we will now recognize one of our most valued members of the investigation subcommittee, Dr. Amibera, MD, for 5 minutes.
Great. Thanks, Mr. Chairman. And while my good friend from Colorado is a lawyer and a politician. I happen to be a doctor and a politician, and in a prior life was chief medical officer for Sacramento County. So it did a lot of public health work. Again, thank you for holding this hearing. I think just from a pure medical and scientific and epidemiologic perspective, it is really important for us to take a look backwards and get a sense of what's happened. And, as the member of Congress who held the first hearing on, at that time, the novel coronavirus didn't have a name, and had chaired multiple hearings on this. One of the first recommendations we made in early January of 2019 or 2020 was that we had to use every effort and resource to get the best scientists into the hot zone, into Wuhan, to not just understand what was going on, understand how this virus was transmitted, but also to help the Chinese in terms of containment. Obviously, that didn't happen. I think, China's response was different, which really was setting up barriers. And I think we'll look back and certainly see a missed opportunity that slowed down our response. That said, the scientists in China, there was a hero in China who, again, probably not at the request of the government, released the gene sequence fairly early and probably did save untold tens of thousands of lives. Certainly allowed us to develop the ability to do testing fairly early on. And it ultimately allowed, Moderna, Pfizer to start working on vaccines as well. So, I'm not disparaging any of the Chinese scientists per se, because I actually think the scientific community would have wanted to work in a collaborative way. It's when the politicians get involved, in this case, the Chinese government, that I think things went awry. I appreciate all the questions of my colleagues. I do think, just from a purely scientific perspective, it is important for us to understand the origins so we can better prepare ourselves both to address and minimize the next pandemic and be prepared for that. As one of the witnesses talked about, I think we do have to go through and get a better understanding of the zoonotic risks that are out there so we can be better prepared for that. But one area that I think is incredibly important for us to think about as Congress is our own biosecurity, because there are bad actors in the world, and for folks watching a virus bring the world to its knees, they've just seen what's possible, and we spend a lot of time. I chair the subcommittee on non-proliferation, and we think about nuclear threats, but what we've just seen is a biological threat bring us to our knees. And as we prepare for the next naturally occurring pathogen, I think we also have to build in systems to address and think about potential man-made pathogens, whether intentionally or unintentionally, that could impact us. I know we were able to get $1.7 billion in the American Rescue Plan to build out our infrastructure for gene sequencing of these viruses. It's helping us right now as we deal with the pandemic. But maybe I'll ask Dr. Relman, as we build out these biosurveillance tools at the global level, as we try to put in these institutional norms for lab standards, as Chairman Foster and I have talked about, what is appropriate genetic research, and as CRISPR technology is readily available to the world. We're teaching our high school students how to do gene editing. There's real risks here. So maybe, Dr. Relman, some things we should be thinking about as Congress to better prepare for the next naturally occurring pathogen, but also to prevent a man-made pathogen from bad actors.
Those are all really, really important, good questions, and there obviously are no simple answers. I think one response would be say that there are multiple approaches that will be needed, no one of which will be sufficient. Part of this, I think, is going to be a question about whether we think there are discrete, probably very small, defined parts of this science that deserve special attention. In other words, might there be a red line? Might there be a place past which we simply ought not to deliberately go? I personally think that there are. I also think that those are vanishingly few, and that we have to be very careful in perhaps drawing a line if we do so that we don't impair or impede the rest of the critical science upon which we depend. So these are really tough problems. I would like to see, for example, our government sponsoring further international discussion about whether there are norms of this sort, how we go about defining them, who needs to be at the table, and perhaps not just scientists and not certainly just life scientists, but social scientists, I think, to some of your points previously made. But that's a start. And this is as much about people as it is about rules. And we're going to have a better understanding of where we all stand on this and a mechanism for ongoing discussion as unforeseen problems arise.
Great, thank you. And maybe that's a topic for a future hearing, Chairman Foster.
No, I agree. And the analogy between nuclear nonproliferation and the dangers of bioweapons and everything from homebrew bioweapons to nation states. And without objection, I actually like to enter into the record a report from the Nuclear Threat Initiative that they issued last fall entitled Preventing the Next Global Biological Catastrophe. And recommended, among other things, stronger mechanisms at the United Nations for determining the source of a biological threat regardless of origin. And so without objection, I'd like to enter that into the record. And next is Representative Gonzalez for 5 minutes.
Thank you, Chairman Foster and Ranking Member Obernolte for holding this timely hearing today, and to our distinguished witnesses for joining us. Dr. Relman, in your testimony, you labeled the work being performed at the Wuhan lab as, quote, unusually risky. I want to focus on that specifically because in 2016, the lab reportedly experimented on a live bat coronavirus that could infect human cells in a BSL-2 lab, a biosafety level compared to a U.S. dentist's office. Furthermore, in 2018, the lab's director, Dr. Shi, gave a presentation with slides that exposed some of her unmasked colleagues working with bats in their bare hands. And then finally, in 2019, Dr. Peter Daszak, one of the lab's top contractors, who has coincidentally been charged with leading the Lancet and WHO investigations, made comments that researchers in the Wuhan lab have found over 100 coronaviruses, including some that can get into human cells in the lab and are, quote, untreatable. I recognize you'll not offer a personal opinion on this hypothesis, but would you agree that this is a troubling fact pattern that warrants further investigation?
I think my response would be to say, we as an international community of scientists have some important issues to address, some of which you've just alluded to. I do think that some of the work that they have described, like work that has been done by others elsewhere in the world, deserves special attention. I mentioned already some of the experiments that I think were unusually risky. And it's not just my opinion, it's the opinion of other well-known coronavirus experts, in fact. But this is work that they had permission to do, at least by their own government. So I think there are many people here that need to be, they need to be in these discussions to decide how do we go about viewing and assessing risk and how are we going to manage it going forward. It's not simply a problem of one place.
No, absolutely. And I think this screams for more global coordination and pressure, frankly. Given Dr. Daszak's professional and financial ties to the Wuhan lab, does it give you pause that an investigation completed by the WHO and Lancet can be considered credible? Because I struggle with that mightily, if I'm being honest.
No, I too, and I've stated this in various places. I was troubled by first of all, the terms of reference with which they began their investigation, their exclusion of certain hypotheses just because, and then second, the skewed treatment of just one and not another. Yes, I think that was a problem.
Thank you. Dr. Perlman, in a 2020 op-ed, you applauded Chinese efforts to share relevant COVID-19 information rapidly and responsibly. We now know that that following the WHO's 2020 mission to China, the CCP implemented a gag order to stop the sharing of any information related to the pandemic so as to coordinate the release of the information with the Chinese government. They've also silenced their own scientists, deleted databases, and of course blamed the United States military for the outbreak, which is ridiculous. Given how the last year and a half has unfolded, do you still stand by those comments?
Yeah, so I think the points you make are very well taken. I think a lot of those comments were made at a time when the world was a little different. We talked about that 2020 Lancet paper, and that did have a big impact, but it was at a time when the world was really divided into those who thought this was all man-made versus a natural origin. And now everything's become more nuanced. And I think it's very appropriate to be more nuanced. I certainly would, if I had to do everything over again and I was really smart, I would have thought about those nuances back then. But at the time, that's what we were thinking. And also the other thing I was thinking about was the SARS epidemic. It took the Chinese government was even more opaque then initially, and it took several months for that to be admitted to. So this felt like it was, in those early days, felt like it was more rapidly done. Information was being spread, but there was no question, even in the very beginning, there was some cover up, because I have friends in China who were telling me that they thought things should have been released more quickly. And this was in the first days of January. So and the problems only got worse, because the things you're describing are what's going to make it so difficult to figure out where this virus came from. Destroying farmed animals, not having specimens available, not having information available. This is the only way I think we're going to figure out this particular pandemic.
Yeah, I mean, just following up, I mean, if the Chinese won't permit researchers to conduct field work and only offer limited access to granular lab records and data, how can we carry out an investigation that is credible and immune to CCP influence when we've already seen such horrible behavior, whether it was a SARS or COVID-19?
Yeah, I think it's something that has to change, because if we're going to figure this out.
Thank you.
If it's possible to add to that, could I make a comment?
Sure.
Yeah, that one of the things I would just like to underline as we're talking about this is that if we're trying to create the entire puzzle, if we're trying to understand the entire picture, and if we think about what we can control, what we do have access to, if we have a jigsaw puzzle with 100 pieces and we only have one or two of those pieces currently available, it's hard to understand everything. But I think the more that we can really develop that robust data set that's independent, perhaps, of that's from the wildlife surveillance, that's perhaps independent of governments, it might give us the chance to have a better understanding, and that might be something we can more easily control.
Thank you, and thank you, Mr. Chairman, for giving me a few extra seconds there. I yield back.
No, I'm happy to. Also, if our witnesses and members are interested, I think we will continue this sort of informal procedure we have of, after we've gavelled the hearing closed, we'll turn off the live feed and just have the sort of private discussions that we have typically after in-person hearings as well, which are often very, very productive and useful. And so now we'll now recognize Representative Beyer for 5 minutes.
Mr. Chairman, thank you very much. And to you, Mr. Obernolte, for holding this really fascinating. Let me begin that I am concerned about the low vaccination rates in Republican-led states continuing to place our economic and societal recovery at risk. And Tennessee's willful abandonment of any attempt at pandemic response is only the latest example of failed leadership. So while we're focused today broadly on the origins, which would be very helpful, and trying to understand how to prevent both a future lab leak or any other future natural origin for a virus, we have to remember there have been more COVID deaths in 2021 than in all of 2020. So we need also to be focused on the variants. And if we don't get serious about addressing COVID, the next variants of concerns are likely to be homegrown, not in China, not in a market, not in a lab, and they're preventable in light of our access to vaccines. So one of the concerns I have is that for much of the pandemic is we're not going to know much about these variants if we don't have good surveillance. So Dr. Murray, can you offer your perspective on the current status of U.S. COVID surveillance? What's working well? What should we be thinking about for the to
To be honest, I think that our COVID surveillance was much more robust just a few years ago. We knew that even 3 or 4 years ago that an epidemic, not necessarily a pandemic, but we knew that an epidemic was likely on its way, and we knew that it was likely to be a influenza virus or a coronavirus, that it was likely to come from bats or primates, and Asia or Africa. So we knew a lot, and I think that we were pretty actively involved in a number of different countries doing that surveillance and creating the database from which all of our scientists and pharma companies need to access information. For a variety of reasons, I think in part due to changes in funding structures that and changing in priorities, that surveillance isn't as robust right now as it was. And from my perspective, I think it's time that we lean in, because that continuous sampling, I think, is what's most critical as we look at trying to understand viral evolution. One other thing I'll just note is that if we're trying to understand how the viruses might mutate in the future, it's very helpful to look at past collections as well, to even like historical collections from the Museum of Natural History, to look at the coronaviruses 100 years ago, 50 years ago, where they are now. It gives us some indication of where to go. So we are still obviously doing, there's a number of different groups doing surveillance, but it's a strange time to be slowing down.
Thank you. Dr. Relman, I was fascinated by your discussion about how in the Wuhan lab they had taken previously characterized bat-associated coronavirus poised for human emergence and then inserting the all-important spike protein from the novel viruses. This sounds awfully dangerous. What was the possible gain from introducing the spike protein into these viruses?
Well, the purpose was to understand the very diversity that you've been hearing about and trying to understand what parts of this diversity may prove to be a true threat to humans. One of the approaches, and I would argue an approach that we ought to step back and perhaps discuss more, is to take the part of the virus that we think is most likely responsible for interaction with human cells, the spike protein, and study it in some way, shape, or fashion. The way they chose to do it was to swap it into another virus whose properties they had just characterized, and a virus that they were able to resurrect and propagate. So these were the chimeric viruses that they created, and they literally did not know what was going to happen when they did that. Their purpose was to see if this starting virus, WIV1, had now become even more well adapted to human cells and more able to grow. They didn't know what the answer would be. And I would say that was a pretty dicey throw of the dice that they were undertaking there.
Doctor, one last quick question. You have talked about the COVID Commission Planning Group, Nuclear Threat Initiative, World Economic Forum. Do you think we can actually build this new global entity to track these things ahead of time?
I do. And I've admitted my conflicts as an advisor to a number of those organizations. But the NTI, for example, the Nuclear Threat Initiative, has a very interesting proposal for a novel international entity that will routinely investigate small outbreaks, which are happening all the time, as a way of practicing how to do this right for the time that comes when something large happens. And so I do like some of these proposals.
Great. Thank you very much. Mr. Chairman, I yield back.
Thank you. And we'll now recognize Representative Waltz for 5 minutes.
Thank you, Mr. Chairman. And just as an opening statement, I certainly want to state my opinion, and I think the vast majority of the American people would agree that it's a little insane. I mean, it's kind of nuts that 18 months after this outbreak, trillions of dollars spent, millions of lives lost, millions more disrupted, businesses ruined, kids falling further behind in school than they already were, that this is the first hearing that the majority has hosted on the origins of the coronavirus. I mean, I just think the total lack of urgency to get to the bottom of this, again, a year and a half after the outbreak is just to be candid, a bit outrageous. And I do hope this is the first of many. This is a very complicated issue. And I do hope this is the first of many to get to the bottom of it. But I certainly applaud that. Let's get started and having the hearing today. Dr. Relman, you walked through in your testimony what an investigation should look like. I think we'd all agree it hasn't looked like that with all of those elements. Key factors are objectivity and conflicts of interest. And you also stated, I just want to make sure I understand you correctly, neither hypothesis should be ruled out. Natural origin or a lab leak conducting that very dangerous research that you just described. Is that correct? They're both viable.
That's correct.
Yeah, thank you. And I would certainly agree. I just trying to wrap my mind around what I think may be the world's biggest coincidence, that the epicenter of this virus happened in a city, the only city in all of China that is conducting research, dangerous research on this virus, 1,000 miles away from natural origin, a city larger than Manhattan, and in a lab that the State Department in 2018 shared real concerns for its safety in a cable. So that brings me over to Dr. Perlman, and it was already mentioned, but I think it's worth mentioning again that in March 2020, you signed a letter that, quote, strongly condemned conspiracy theories that suggested COVID-19 does not have a natural origin. And I have to say, the entire world was looking to the scientific community at that time, just months after the outbreak. And that really did set the tone. And it's no surprise then we had the media and big tech banning any discussion of anything but natural origin. Dr. Perlman, do you still stand by that any discussion is a conspiracy theory, that Dr. Relman, who says it's a viable hypothesis, that it's not natural origin, is a conspiracy theorist? Do you stand by that statement?
So remember, the statement, as I said just a few minutes ago, the statement was based on the notion that this was constructed from scratch. So that was really what the letter was about. I don't think it was defined well enough in that letter, but that's what the discussion was. It wasn't about all these other possibilities.
Now that it is constructed from scratch, you would call it conspiracy theory.
Well, I don't know, conspiracy theory obviously has a lot of pejorative terms with it. So it's not a term that one would want to use lightly. I think the idea at the time was, though, that this was all being convoluted so that a whole bunch of possibilities were put into the idea that this virus was made from the beginning.
Dr. Perlman, what that letter had the effect of doing was shutting off very viable lines of investigation into whether this came from that lab, which we are funding with U.S. taxpayer dollars, indirectly or directly. And we can't stop the next pandemic, the last 3 of which have come from China, without understanding where it came from. And now here we are a year and a half later, just trying to start figuring this out. And then you sign the Lancet Commission letter, which Peter Daszak has since resigned and recused himself from because he's receiving funding and his livelihood is dependent on the very type of research that we're asking him to investigate. So I think, yes, the Chinese cover-up has been abhorrent, but I think, Mr. Chairman, just as inexcusable is a scientific community who has not been objective, who has effectively shut off lines of research, whose livelihoods depend on funding pertaining to that research and could be compromised. And I think we as a committee need to take a hard look at those backgrounds. And if there are conflicts of interest, as Dr. Relman pointed out, before we move forward in an objective way. I thank you for holding this, and I yield.
Thank you. And we will now recognize Representative Stansberry, if she is willing to activate her video. Yes.
Thank you, Mr. Chairman. It's nice to be here this morning. I really appreciate the opportunity to ask a couple of questions during this hearing. Mr. Chairman, my questions are for Dr. Relman. The first question I have is about laboratory biosafety. As you pointed out in your testimony, the lab accidents involving dangerous pathogens occur more frequently than we would like to admit, even here in the United States. But one of the things I'd like to kind of just put on the record is a little bit about the biosafety standards in American laboratories and your thoughts about how we can ensure that the highest standards are upheld not only in the United States, but proliferated internationally.
Thank you for the question. I think from my perspective, safety and security are about both guidelines, rules, or regulations, as well as people. And the people part is as important as any of the other. The finest rules and regulations, if not properly followed or believed in, simply don't serve us to the degree that we need. So I agree that this is a collective responsibility. We here in the United States, I think, have further soul searching to do, but building upon good efforts that have started already. And so I would like to see more attention to this and more attention to the idea of how we can provide incentives, positive incentives for people to believe that this is important and worthy of some attention.
Thank
I
you.
can add to that, Representative Stansberry. Is that okay?
Yes.
So in the U.S., the BSL-4 is the level of laboratory that would require that work with this type of virus and would have oversight in clinical samples by the Joint Commission and the Clinical Laboratory Standards Institute. And I suppose if research only, Drs. Relman and Perlman can correct me, but the CDC would probably oversee that. And the Joint Commission accredits 22,000 healthcare institutions in the United States, but there's also an international arm that accredits hospitals around the globe. And currently there are 54 such hospitals in China that are accredited by the JCI. The Centers for Medicaid and Medicare Services also regulates some laboratory testing via CLIA. And there is an ability for international laboratories seeking CLIA certification to do so. So I do wonder, in addition to what Dr. Relman said, is if there is a will to have some regulatory oversight, more so at a global level, using some existing structures that we have.
Thank you both. And thank you, Mr. Chairman. My second question is about the kinds of research that we're talking about, including gain of function research. Dr. Relman, you argued in your testimony that we should consider whether or not there are certain kinds of life sciences research that is so risky that perhaps it shouldn't be undertaken. And I wanted to understand a bit more about gain of function research and how this research is used in microbiology, how common it is in vaccine development, and what we can understand is how it might apply to what we're discussing here today.
Thank you. I'm not a big fan of this term, gain of function, because it's confusing and used in confusing ways. I would prefer to talk about risky research that is unusually risky, and for several reasons. To me, the two properties that matter most that we need to be concerned about are the property of something being able to do harm, so that's pathogenicity, and the property of transmission. Anything that has both of those properties, something that can do harm and can transmit easily, is something that we need to pay attention to. And to make it very simple, I would argue that we should not go about deliberately, intentionally creating something that has both of those properties that doesn't exist in nature without a very, very thorough and well-informed discussion. That's the kind of thing that gets out of control very quickly. And if it hasn't yet happened, it will. I'm just very concerned about that kind of work.
Thank you, Dr. Relman. And with that, Mr. Chairman, I yield back. Thank you.
Thank you. And we will now recognize Representative Feenstra for 5 minutes.
Thank you, Chairman Foster and Ranking Member Obernolte, for the opportunity to participate in this first official hearing on COVID-19 origins in the U.S. House. And thank you to all the witnesses for your testimony and sharing your extensive research and experience with us on such a crucial topic today. Dr. Relman, in your testimony, you mentioned that some say further clarity about the origin of the COVID pandemic is no longer needed. I personally think that's absurd, and I was happy to see that you disagree with him also. Following up on past questions, can you elaborate on the potential consequences of not investigating the origin of the virus?
Sure. And to clarify, I think the viewpoint that I was seeking to portray was one where a number of people have said, this seems so difficult. It seems so unlikely that we are going to gain greater clarity for some of the reasons that have been discussed here this morning, that perhaps the effort is not worth it. That the effort, which will come with a lot of political difficulty and complication, perhaps ought not to be undertaken. I disagree with that. I do think, for a whole number of reasons, there are likelihoods of greater insight into the origins of the pandemic, in part because science is such an international undertaking, and that there are lots of useful kinds of information that are going to come from all corners of the globe about how this pandemic began. But I do think it's critical that we pursue this, and the reason is that, in part, if we do nothing further, one of these two hypotheses, in my view, continues to be so difficult for some of us scientists to discuss. The idea that one of us could have caused an accident, that one of us made an error, that it will not be pursued with sufficient rigor and attention. And that's my concern, should we simply drop this now.
Yeah, Dr. Relman, I fully agree with you. I mean, I think everyone, we owe it to the world to understand, and that we never let something like this happen again if we can come up with the way it happened, and then to protect ourselves that it never happens again. Dr. Murray, you worked as part of a governmental funded USAID consortium to collect dormant viruses and study infectiousness, and sometimes implemented gain of function research to predict disease outbreaks, risk factors, and create predictive models. I got two questions. How does the COVID-19 emergence and spread compare to your predictive models? And then what are your predictive models and risk factors your team considers for laboratory accidents?
Thank you for the question. Just to clarify, we were not involved in any gain of function research. We were doing surveillance, both human and wildlife surveillance in several different countries. And then in terms of, we do have modelers on the team who look at how diseases can spread. The places that we were most active in is looking at some of the gaps and recognizing that if we want to understand how viruses can best spread, there is a missing gap of social scientists, and looking at what humans do to put them at times in harm's way, and what the riskiest behaviors are. So we have spent a fair amount of time developing some strategies and making sure we're incorporating social scientists and behavioralists to investigate cultural norms and to better understand, to build those partnerships with folks in different countries, so we can address, so we can all be part of the solution as part of the problem per se.
Well, thank you. And I'm an academic myself. I'm actually doing research, and funny, I'm just going through an IRB hearing as we speak. And it concerns me that, I take into consideration all the risk factors when I'm doing research. And, here we have a situation that we're not sure exactly how it happened, but we have to be very cognizant of the risk factors that happen. And, I'm sure it didn't happen on purpose, but how did could it have been a laboratory accident? And how do we make sure that never happens again? I'm not saying it necessarily was, but it could have been. And I just hope, Dr. Murray, that your studies can look into this more. And I would just like to hear a little more of your thoughts on that.
I think that one of the best things that we can all do is look at what our research so far has identified, and then also identify the gaps. And part of the gaps, I think, is looking at a risk analysis, and risk analysis across the board. I think my esteemed colleagues on the panel have said the same thing. And there's many places along the way, from the human behaviors in the field and how people come in contact with wildlife. Living and then also dead wildlife. Whether it's the risk is in a restaurant, whether it's eating wildlife or whether it's preparing the wildlife ahead of time, and then what happens when you bring it back home. So everything all the way through, looking at risk factors in laboratories as well. And the more that we can all feel comfortable and develop the trusting relationships to say, hey, this is an area we should really look at more closely, the better.
Thank you. And I yield back. I fully agree. This is very serious. And in all research, we take human subjects very, very, very seriously. And I just hope that we look at that further. Thank you. And I yield back.
Thank you. And now, despite the fact that he only has a master's degree in biochemical engineering, we will recognize Representative Gaston for 5 minutes.
Thank you, Doctor. I really appreciate you guys all being here. I want to be careful picking my words here, because I want to ask something that's going to sound controversial, and I hope that my colleagues across the aisle will take it in the spirit it's intended. I've had this fear from the start of COVID that we're repeating some of the mistakes we made in the HIV crisis, in the sense that there are political conversations we're uncomfortable having. And because of our discomfort having those political conversations, we've allowed this to spread in ways that it shouldn't. And this is going to sound political because we're all politicians, but it makes me so sad that we're seeing, certain political populations less likely to get vaccinated, more likely to die. And if we can't talk about that epidemiologically, then we're leaving something out of the conversation. Layered on top of that is the fact that we have created some real risks to health and welfare because of that politics. I had an Asian American constituent who was attacked with a stick a year ago and told to go back to China, which was not where he or his family tree was from, but it was the way he looked. And so I guess my question for you all as scientists who, if you do your job well, you are looking at all the data and asking questions without any presumed answer. How would you like us as political figures, hopefully political leaders, to speak about those issues in a way that maximizes your ability to do your job effectively? And happy for any of you who have answers to that, but I think we're all in our line of work. We could use your guidance and wisdom to make sure that we don't unnecessarily inflame things while still making sure that we don't ignore hard questions as we did during the early stages of the HIV epidemic. Any comments would be welcome.
Personally, I really like the idea of us, it's been mentioned a few times along, making big efforts to bring the public along. As scientists, we do a lot of work, and we collect data and we share it with other scientists, but we don't always make the effort, or sometimes we're not effective in translating that information to the general public along the way. I do feel like we have known a lot about that epidemics that were on their way, and had we more effectively communicated with the general public, I think we would have been better able to respond more quickly. And that's my thought.
I would follow up and say I have appreciated this subcommittee's willingness to consider all theories of the origins of COVID-19, even though some have somehow generated a political view or polarization behind each of those theories. And I think it's important to remember that we don't have the data. We have to use the science and back off from anything that seems to be going to the left or the right, and just look at the data and make conclusions based on that alone, and be open until then.
I would simply add that from an international point of view, in my humble opinion, it's humility that we as a nation need a little bit more of. I think we've been a little quick to point fingers and suggest that we're not equally, culpable in some cases for either promoting factors that encourage natural outbreaks, or for promoting certain kinds of science that carry unusual risks. And I think, it's that glass house analogy. We have to be careful about where we throw stones without first saying, look, we're fallible just like everyone else. Here are some examples of problems that we have discovered amongst our own. Now let's have a more open conversation about where we each see this being the case.
Well, thank you.
Can I just add something to that?
Yeah. Oh, yeah. Sorry. Please go ahead.
Yeah. So I'm on the FDA and the ACIP vaccine committees. So we actually think about the first part of your question about how do we get vaccines into the whole population. And I think it's not only politicians being all in agreement about whether vaccines are necessary or not, but I think we think pretty strongly that bringing in community leaders and making sure that everybody is on the same page about the importance of vaccination. Because both in the US and the rest of the world, this vaccine hesitancy is a big deal in terms of having problems in ending the pandemic. So there's a lot of places in the world there's not enough vaccine, but even where there is, there's still so much hesitancy. So I think that it's just making it very clear that everyone thinks vaccination is the way to move forward is really an important intervention.
Thank you. I yield back.
Thank you. And now with some relief, we will return to the other PhD in the Science Committee, Representative Baird.
Thank you, Ranking Member Obernolte and so now, is that coming through better?
Yes.
I really appreciate Mr. Chairman holding this kind of a discussion. And it seems to me that the purpose of this hearing, and I commend you for taking the opportunity to do that, is to look into how this COVID virus was released. There's two theories at the present time, one about being an animal to human situation or a zoonotic situation, and the other being the laboratory leak. So my question comes down to is how we identify and how we can be helpful in trying to reestablish or reaffirm, as some of you have suggested, the credibility for our scientific community, because they really haven't had a chance to weigh in. So I guess I'm going to start one question with Dr. Relman. You in your testimony, you had discussions about international governance mechanisms leading to the investigation of the COVID-19 origins. And so from your perspective, how do we reestablish a protocol that is appropriate and effective for convincing our society that our scientists can make the appropriate conclusions? And so I would appreciate your comments on how we can identify the bipartisan, transparent program for investigating the origins of this COVID-19.
Yeah, it's a tough question. There are issues of governance and of authorities, and then there are a set of other issues around which I feel I have a little bit more familiarity, which is how do we articulate the questions at hand carefully? How do we decide upon the kinds of data that will best address those questions? Then how do we decide upon the right expertise to make use of those data in addressing those questions? And finally, the process that will be used. All of those four things, I think, still need some attention. This is where your committee has, I think, important standing. You're all about how does a proper investigation become well articulated and empowered and defined. And that's what we need here. And I think once we have those four elements better articulated, we'll have a better ability to decide who is it that can best do this and how are we going to proceed.
So if I'm understanding you right, I think now is a good time to review how we think that protocol ought to be. And maybe this committee is a good place to start with reviewing that. And then that adds credibility as if we approve that and move forward. Am I understanding that correctly?
Yes, I think so. And there may well be good partners for you who have already begun this process. The COVID Planning Commission that I referred to in my testimony, national academies that's begun to have conversations, and other national academies around the world. So I think partnerships, perhaps informal between countries with various kinds of standing and roles to play, could be a part of this discussion with you as well.
So thank you very much. And I yield back, Mr. Chairman.
Well, thank you. I think at this point, unless there's someone lurking on Zoom, I think we are now out of members with questions. As I mentioned earlier, we will, after we gavel this hearing closed, we'll be able to have an opportunity for sort of informal conversation, sort of the electronic equivalent of hanging around in the ante room after this. And so any members or panelists who are interested in that, you're very welcome to. So with that, I will thank our witnesses again and gavel this hearing closed.